Hey guys, I'm Dr. BJ Hardick with MaxLiving. Today we're talking about degenerative disc disease, and we're talking about chiropractic care as it relates to that. And we're also talking about the impact that that can have on your overall health, because I think everyone wants to age gracefully and have a healthy, abundant life as time goes on. But you know, a study was released in the year 2006 in the Archives of Internal Medicine, which had studied over 4,100 men between the ages of 60 and 80 and looked at basically how much they had shrunk. And men that had shrunk 3 centimeters or more compared to the men that had shrunk only 1 centimeter, they had a greatly increased risk of cardiovascular disease and all-cause mortality. In fact, that was up over 60% compared to the men who had only shrunk 1 centimeter, which really isn't even a good thing to begin with. But where are these men shrinking between the ages of 60 to 80? You know where they're shrinking? They're shrinking in their spines as a result of spinal degeneration. And what the article and what the study revealed is that the more likely disease that would actually kill these gentlemen was cardiovascular disease. The chiropractic understanding has always been that the brain and the spinal cord and the nervous system run your body. And that brain and the spinal cord and the nervous system, it is housed within the spinal column for protection. Therefore, the chiropractic premise has always been that when there's degeneration, that when there's poor posture, that when there's compression in the spine, that can have an impact on the nerves that exit your spine and therefore the health of your entire body. As the adage goes in chiropractic, the structure of your body influences the function of your body. And even when you just think about overall posture, when people shrink this way as well, that can cause added pressure onto the heart, added pressure onto the lungs, and that is something that we want to avoid. So from a chiropractic and a MaxLiving perspective, how can we prevent that? Because I think anybody who wants to live a great, healthy life would want to avoid that degeneration as best as they possibly can. The first thing is this: the chiropractic principle really looks at addressing areas of fixations in the spine so that they do not degenerate. By the time something is degenerated and decayed, often there's been many years of damage. So a chiropractic analysis really looks to identify, are there areas of misalignment with respect to the posture, both in regions of the spine, but also those individual areas. What can be done to get the alignment and the motion as best as possible so that we can prevent the degeneration, which would be likely what is going to occur as a result of sitting and stress and decay over time. And also, nowadays, modern day chiropractors are also going to look at movement for the body in terms of the exercise that is recommended for you, but also just everyday rehab. One thing you have to remember about those discs which can degenerate, they don't have arteries going to them, just filling them up with nutrients. They require movement on a day in and day out basis in order for them to go through this process of what's called imbibition. I know that's a scientific term, but that literally is the way that the nutrition gets to the joint. So the body requires movement on a daily basis to prevent the degeneration, prevent that shrinking in the spine, and therefore help people offset all those complications with cardiovascular disease, and also improve the overall quality of life. Plenty more tips on spinal health, exercise, movement, oxygenation, and the 5 essentials on maxliving.com.